Hello, Partnering for Vaccine Equity Learning Community members from the 2106 funding stream, and welcome to this afternoon's learning event. I'm Bridget Courteau, the Director of Group Learning for the Learning Community, and on behalf of our team at the Urban Institute, thanks for being with us this afternoon. I'm joined today, next slides, please. I'm joined today by Samra Ashanafi, who you know as the CDC's project officer supporting your 2106 funding stream, and who is also the acting team lead for the Racial Equity Adult Partnership Team in the Partnership and Health Equity Branch in the CDC's Immunization Services Division. Samra's extensive public health experience includes directing and managing immunization and family planning focused programs abroad, including in Ethiopia and Zambia, and evaluating CDC's cooperative agreements with minority health professions schools. I'm going to hand things over to Samra to introduce our meeting topic and our speakers, but first I'll do our typical quick review of how this session will work. So you've all been muted upon entry to the session. Please stay on mute unless you're speaking to keep the discussion going without accidental interruptions. We'll be using breakout rooms in the second half of the session after the quick talks. When the time comes to move to a breakout room, you'll randomly be assigned and then automatically sent to one. The chat room feature is also open today. We encourage you to use it, introduce yourself, or type a question for our speakers at any time. We won't be doing Q&A after each short presentation, but speakers may be able to answer some questions over chat. And we've also reserved some time at the very end of the session for speakers to do a general Q&A that can be about any of the presentations or anything else that people might want to bring up. We offer live interpretation from English to Spanish during our events. If you would like to listen to the Spanish language channel, simply click on the globe icon in the Zoom taskbar at the bottom of your screen. We'll also be sending our interpreter to breakout room 1, where the facilitator is also fluent in Spanish. So if you need or prefer Spanish language interpretation, please send me, Bridget, a direct message over chat, and I'll make sure that you are assigned to room 1. And finally, as with all of our learning events, we will post the slides and a recording of this event on our community website and circulate them through the digests that go out through the CDC-managed Adult Vax Program listserv, which all program members should be a part of. And finally, if you have any technical difficulties at any point during the session, please send us an email. Send it to our community manager's inbox. That's vaxequitylearning@urban.org. It's on the slide here. And we do watch that inbox during the events. We'll try to help you as quickly as we can. And now it's my pleasure to turn the mic over to Samra to share a few words about the session and tell you about our excellent lineup of quick talk speakers. Samra, the floor is all yours.
Thank you so much, Bridget. I appreciate it. During one of our, or a couple of my one-on-one meetings with our PAVE partners, I was hearing about your interest to learn more about, what your peers are working on, how they're changing the strategy from year 1, what they've learned, and are incorporating it into strategies for year 2. So that's exactly how the quick talks came about. Thank you for that. And, I spoke with Bridget and, we ended up doing a session for the larger PAVE partners. And then now we're holding one just for the 2106 recipients and sub-recipients. So it's really wonderful to see how a suggestion, during our one-on-one has evolved into this quick talk session. So our hope is that, during this session today, that you'll learn more about what your peers are working on, as in the quickly changing COVID landscape. The pandemic is ever evolving and we always need to tweak our strategies. So we have 3 speakers with us today, and they'll do a 5-minute quick talk and then facilitate a small group discussion. That's when you will really get a chance to, hear from one another and also share your experience on what you've learned in the Partnering for Vaccine Equity initiative. So to introduce our featured speakers, I'll be introducing them in the order that they'll be speaking. First, we have Lance Goller, who is the Vacunas para Todos Project Director at the National Alliance for Hispanic Health. He has more than 18 years of experience in leadership roles and nonprofits focusing on social justice for underserved populations. It including, working for HRSA-funded COVID-19 vaccination projects involving over 500 community health workers at 41 agencies in 20 states, leading health insurance access projects in several states, and managing local, state, federal, and foundation grants. Lance holds a bachelor degree from City University of New York and a master's degree in public administration from Bark College in New York. He's also a fluent Spanish speaker. Next, we have with us Chini Okochaku, who is a quality improvement and equity project manager at the National Minority Quality Forum, where she assists in implementation of QI education projects for clinical teams and community leaders in diverse and underserved communities, with a focus on immunization improvement programs. Chini is a passionate public health specialist with a proven track record of accomplishments in health education, health promotion, growth strategy, and high-level partnership creation at the national, state, and local level. Chini holds an MPH from Southern New Hampshire University. And last but certainly not least, we have Anthony Magalki with us. He is a program manager for the Asian and Pacific Islander American Health Forum for the COVID projects. He has an extensive experience in Asian American, Native Hawaiian, Pacific Islander communities, including Asian Pacific American Institute for Congressional Studies as the head of communications, operations director for Florida Asian American Student Union, and executive director for Southeast Regional Conference of Asian American Leaders. Anthony graduated from Florida State University with a BA in International Affairs and Political Science, as well as a Master in Administration and International Affairs. Thank you so much again for agreeing to share your experiences with us. So now let's go ahead and get started with our quick talks. Lance, I will turn it over to you. Thank you.
Thank you, Samra. You can go to the, so I'm with the National Alliance for Hispanic Health, and if you want to go to the next slide. So we have a model where we, as a national organization, have a national program where we have a communications program using our communications platform. But most of the work that we accomplish for the 2106 program is through our 16 subrecipients. And so I thought it would be easy if I would just show you a map of where our subrecipients are. So we have 16 subrecipients located in the locations that you can see. They are in 8 different states and 2 territories, DC and Puerto Rico. And our subrecipients are comprised of a variety of types of agencies. They include 5 federally qualified health centers, 3 other healthcare providing agencies. We have 4 Hispanic-focused social service agencies, and 2 senior services agencies and 2 universities, one which is a school of pharmacy, and the other one which is a biomedical research program at the Texas border that houses a community health worker training program. And our target population is underserved Hispanics and Latinos through this work. You can go to the next slide. So during year 2 for our PAVE project, we have several goals that we're working on. One is to increase the use of our community vaccine navigator model, which we developed through a separate grant sponsored by HRSA last year, and have incorporated that model into our CDC-funded PAVE project. We're also working on providing more robust training for our trusted messengers during year 2, and making sure that any trusted messengers that we recruit have robust knowledge and messaging that they can share, as well as messaging strategies so they can be persuasive with other people. as well as we want to promote shared learning amongst our subrecipients. And so during our monthly meetings, we have typically we have 2 of our subrecipients share best practices and interesting outreach models that they're using, and we've found many of the methods that they're using to be innovative and instructive to the rest of our subrecipients. So a few pearls of wisdom that we've learned from these partner agencies as we're facilitating this learning. The main lesson that we've learned is that how important it is for our Promotora model, our community vaccine navigators, and how much they make a difference. While social media does have its place and is important, one-to-one discussions are where much vaccine equity can happen, and encouraging people to think about the importance of vaccines. We also feel that community vaccine navigators or promotoras are very important given with our target population, given their rates of uninsurance as well as other barriers that they face in terms of obtaining vaccines, including not having a regular healthcare provider or having transportation barriers. And now that vaccines are no longer subsidized to the degree that they used to be, facing increased costs. So having community vaccine navigators help our target population navigate through these challenges we find is really helpful. As part of that, another pearl of wisdom that we've learned is that business and workplace outreach is highly effective. And in some cases, our community vaccine navigators go from business to business or from workplace to workplace to try to get people to bring vaccines to workplaces or bring vaccines to businesses so that everyone on staff can have a chance to get vaccinated. And we've had situations where we visited meat packing places and other large businesses and had more than 100 people get vaccinated at a single time. So that is part of our community vaccine navigator approach. And we also recognize that technology does play a role, and some of our agencies are using technologies such as geofencing and QR codes as part of their outreach. And so with geofencing, people that come into a clinic, it kind of tags their smart devices and then sends them targeted ads that are encouraging them to get vaccines. And those targeted ads then will follow them around for a few weeks to encourage them to get vaccines at that health center. So these are some of the models that were pearls of wisdom we've learned. And if you can go to the next slide. Some of the things that we are interested in talking about in our breakout room is best practices for recruiting and training trusted messengers, how to make best the use of community health workers. The issue of misinformation is something that is constantly coming about, as well as we all have the question number 20 on our REDCap reports, which is educational campaigns for healthcare providers or professionals, and interested in discussing issues related to how we can reach that goal. And you can go to the next slide. And that's the end of my presentation. Thank you very much.
Thank you so much, Lance. Appreciate your presentation. I know Lance has, shared a lot of, his experience, specifically when it comes to recruiting and training the vaccine navigators. There has been a lot of interest. So I'm sure that will be a topic of discussion, perhaps in the breakout room. Next, we have Chini.
Hi, good afternoon, everyone. Thank you so much, Samara. My name is Chini Okachukwu, and I work for National Minority Quality Forum. We're located in Washington, D.C. And National Minority Quality Forum has several business units or arms, if you will. And one of them is Center for Sustainable Healthcare, Quality and Equity. What we do mostly at SHC, like we call it, is we're focused on promoting sustainable, healthy communities, especially in diverse and underserved populations. And we do this by providing actionable data, engaging and training clinicians and community leaders. Our vision at SHC, simply put, is building sustainable, healthy communities in every zip code. And you can see more of that on at our website with the link that's on that slide. Next slide, please. Oh, sorry, on the last thing on that slide. Next slide, please. Thank you. Well, in year one, what we did was really create a community engagement programs that we took a hyperlocal approach to addressing vaccine inequities, especially among Black and Hispanic adults. That's our focus. And we did this because we wanted to understand people's beliefs, their concerns, encourage conversations, provide education, as well as spark a vaccination movement in communities of colors. And we wanted to do this using trusted voices. And we were specific with the programs we created, we're specific about the voices we wanted to hear. We wanted to hear pastors, so faith leaders. We wanted to hear barbers and stylists, and we wanted to hear pharmacists talk to people. So the Faith Health Alliance was born mainly as a network of churches who promote health in their congregations and communities using voices of pastors and faith leaders. Historically, until late, I think the second quarter of this year, we've been an all-Black church. It's been all Black churches until recently when we have recruited our first Hispanic church in New York, and we're very excited about this. The Hair Wellness Warriors is a program that recruits barbers and stylists from across the country in collaboration with the University of Maryland's School of Public Health, specifically the Center for Health Equity. And the program was born by Dr. Stephen Thomas. He's the founder of this program. And like I said, it's really focused on having barbers and stylists be trusted voices in communities to increase vaccine uptake. So what they do is in their stores, they encourage vaccine education materials. They host vaccine clinics. They link folks up to where they can get vouchers or get actually vaccinated at health centers. Just little conversations, like Lance said, one-on-one conversations sometimes makes a difference. And that's why we have been intentional about creating these programs. The other program we created was the Community Pharmacist Ambassador, which uses the voices of pharmacists. We recognize that pharmacists are available in every community, even when they might not be a healthcare provider, and that these pharmacists are able to make a difference in people's lives in ways that providers may not be able to. And so the Community Pharmacist Ambassador program was born. Next slide, please. I should also say that the CPA, which is the Community Pharmacist Ambassador program, is in collaboration with NovaScript Central, a pharmacy provider in Northern Virginia, who's very popular for providing medication to underserved and uninsured population in Northern Virginia. All right, so I also want to mention that most of these programs that were born as collaboration to our already existing efforts for the flu vaccination by the work that we do with our Drive Toolkit and our Health Champions Toolkit, which you'll have access to the website on the next slide. Next slide, please. So in year two, what we did was take feedback from our community programs and try to improve on what we had learned. So in year two, what we did was making sure that we not just focused on COVID and flu vaccines, but now focus on all adult vaccinations, as well as try to address other health conditions that our community leaders have brought to the forefront. So part of what we heard in year one was COVID, flu have been there, will come and go, you always show up for these. What about diabetes, hypertension, so many other conditions, right? And so what we did was try to make sure that we're having these other conversations that are important to our communities in line with what we want to see them do, increase vaccine uptake. And so what we did was really go back and tie programs or events with our community partners that make sure that it addresses both our needs and their concerns. I give you an example. Over the summer, the Faith Health Alliance encouraged all our churches to take advantage of the good weather, the warm weather, host health events. And we had a number of events in all our churches, stemming from car shows to family fairs, to family reunions, backpacks for kids, backpack to school programs for kids, all kinds of programs. And at every one of these events, we had people talking to them about COVID shots. We had people provide COVID shots. We had people talk about COVID, the flu vaccines as well. We had 2 events that just happened this past weekend, and at those 2 events, the flu shots were also given in addition to the COVID shots. So one other thing I'd like to say about our lessons learned and what we're doing now in year 2 is more than ever, we're linking up our community partners with providers in their communities so that they are not on their own. And when they need to, they have the support of a healthcare provider. Next slide, please. So pearls of wisdom for us that we're applying from year 1 is number 1, we're making sure that our we're building sustainable community health-centered health equity by applying the pandemic lessons that we've learned from the vaccines to total health. One thing I should say at this point is that we have, since the beginning of this year, been having a series of Total Health Champions webinar series. And the unique thing about this webinar series is that we have a vaccine expert's voice on the call. We have a community expert's voice on the call. We have an expert on the disease state that we're speaking about. And then not just that, we have real-time feedback from participants using the Jamboard. We're also engaging the community. We've also learned that engaging the community, so trusted voices, makes a difference with vaccine uptake. And then finally, that every opportunity we get to speak with one individual, we're maximizing. So we're not just talking about just the COVID vaccine and flu vaccines anymore. We're now talking about any missed vaccines that the individual, whether child or adult, but especially adult, may have missed. Next slide, please. And in our breakout sessions, some of the things that we'd like to talk about are any anticipated challenge. I'm sorry, I'm reading the question. So we're trying to find out from you, what creative ideas or approaches have you been using in ensuring that your community partners, your providers in your communities continue to make strong recommendations about the flu and the COVID vaccines. We're hearing talk that some folks are getting tired, getting fatigued about talking about the vaccines. So are there any creative ways that you're finding that is working for you in continuing the conversations? And then, so that's really going to be the challenge that we're having right now because of staff burnout, smaller clinician sizes, people being aware of the conversation of vaccines. We're wondering if folks have any creative ideas or approaches to share with us. And then ways that our program has evolved. Our programs are growing. The Faith Health Alliance grew from 8 churches to 17 this year. Community pharmacists, we're working our way up to 50 registered, trained community pharmacists. And our health wellness warriors went from 10 and we're at 20 this year. And the beautiful thing about these programs is they don't stand on their own. So what we do is at health fairs by the churches or the stylists, we bring in trained pharmacists and try and get them to provide clinical information at these events. I talked about the Total Wellness webinar series already, and then promoting community groups, like I said, to continue to collaborate with their local physicians and health systems. And yeah.
Thank you. Thank you so much, Amy.
You're welcome.
Great presentation. And I think the partners and people at CDC always love to hear about what you're doing with the work that you're doing with the pastors and also the hairstylists and the barbers. I always get questions as to how that's really working. So very interesting. Thank you for sharing. Next, we have Anthony.
Hello, everyone. Good to be here. So grateful to be here alongside Lance and Chinny. Again, my name is Anthony McGlockie, stepping in for Tracy's son, who was originally supposed to present. But yeah, I am a program manager for our COVID initiatives here at the Asian and Pacific Islander American Health Forum, or for short, the Health Forum. We are the oldest health advocacy organization serving Asian Americans, Native Hawaiians, and Pacific Islanders across the nation, the US, API, and territories. Our Partnering for Vaccine Equity project is known as EVAC, which stands for Engaging AA and NHPI Communities in Adult Vaccination. We have 26 very diverse communities based organizations who are subrecipients, serving in many different areas and communities under the AA and NHPI umbrella at the local, state, and national level. Next slide, please. With our year one P4V funding, we oversaw and provided support for these organizations in order to increase flu and COVID-19 vaccine confidence and uptake through culturally and linguistically appropriate outreach. Briefly reviewing some of our year one activities, including us and our partners, we launched our national AA and NHPI Health Response Partnership, which is a coalition which many of our EVAC subrecipients are a part of, that uses a community-centered model and provides on-the-ground public health outreach across the nation. And we also launched an accompanying website, which is a hub for culturally and linguistically appropriate resources, up to 35 Asian and NHPI languages. Of course, we also partnered with and equipped our trusted leaders in the AA and NHPI communities to deliver effective messaging, including the launch of a young adult train-the-trainer type of model and curriculum. We also conducted research on barriers to vaccine access and confidence to better inform our work, which included insights onto mental health, healthcare access, economic impacts. Disaggregated data isn't always readily available, so it's important for us to make this available to our community-based organizations. And lastly, we also worked with community health clinics to increase vaccination opportunities, a lot of pop-up clinics with interpreters when possible to increase access so people with transportation issues can still easily go. Some of our organizations provide shuttles or free Uber rides and even childcare as well. We also wanted to note that weekend and after hours clinics were also crucial to support our 9-to-5 workers. Next slide. Now for our goals for year two. We really want to try to increase collaboration between our organizations, given the diversity of our communities and our different locations. Sometimes it can be a bit siloed, but in the past, we have worked on producing resources and events together to see more of that collaboration. We noted that COVID-19 fatigue is strong, so we're having to adapt our messaging and outreach to community members, being less engaged with COVID-19 focused materials or events. I'll touch more on this in lessons learned. But we are really excited for October because we are convening our partners in person following our annual Voices conference, which was virtual in the past couple of years due to COVID. But we're looking forward to reflecting on our work and also discuss future plans and increase the collaboration rapport amongst our CBOs. Some of the lessons learned that we hope to pass on to you is that language access is a huge issue for AA and NHPI communities. So we do our best to develop and distribute in-language resources in a timely manner. However, this can be really difficult to keep up so that we make our resources easily changeable in a timely manner. We also talk to our translators to translate things ahead of time in anticipation of changes, such as age ranges for vaccines. So the creation of these easily editable and updatable resources is what's key, especially in providing language access. In certain situations, we modify our approaches to COVID-19 messaging to combat fatigue. We're not always making COVID-19 the sole focus. For example, last June, we had an event with our NHPI CBOs where we focused more about COVID-19's impact on our sense of community and the importance of effective and real community engagement versus just talking about why vaccines are important. One of the helpful things that we found this year is our partner presentations during our meetings. We convene our subrecipients on a monthly basis via Zoom, And we start off each meeting with about 3 to 4 presentations from our partners so that they can dive in depth more into each other's work. And we've noticed that this is a more collaborative and positive effect, being that some of our partners have questioned, where's our role in this, and how can we be of help to our other partners, rather than just showcasing and regurgitating all the work that everyone has produced, and being an effective community partner. Next slide. So the discussion topics for the breakout rooms. These are the questions that we have. Some of the bivalent booster messaging. What helpful strategies are you considering? Resource creation. We would definitely love to hear about how you all are keeping your messaging relevant or creative approaches to developing these resources, and as well as flu messaging. Next slide. Yep, that's my information. So thank you, Samra, for everything and for hosting us. Lance, Chinny as well, being alongside you all. Thank you all for your time.
Thank you so much, Anthony. Great presentation, and always wonderful to have all the different resources that APHIF produces in various languages, and the needs assessment studies, etc., have been really helpful to our partners. So this concludes our presentation, and we'll be heading into the breakout sessions. So we'll be in 3 different groups. I'm gonna hand it over to, I think, Bridget, to tell us how that's going to work.
Yes, so shortly Zara is going to open the breakout rooms, and it will be automatic. You don't have to click anything, just sit where you are and you will be transported to your breakout room. And we will, let's see, we're running a little long, but we also have I don't think the breakout rooms will be very big. So let's see, we'll do maybe 12 minutes. We were planning on up to 15. So I think we can set the timer for about 12 minutes. And then there will be time for us when we get back to report back and just share a little bit about what happened in each of the breakouts before the end of the session. So Zara, go ahead and open those up.
Where we allow the community.
Sorry, I forgot to record at the very beginning. So sorry.
All good, all good. Basically, in considering the messaging, it's allowing the community leaders to kind of tell the stories of the impact and what they're doing to heal as a community, and then while obviously sprinkling in the messaging to inform the discussions. Whoever would like to go next.
I have more of a question because I don't, work within organizations like y'all's. I more so provide technical assistance to other organizations that are funded under this program. And so providing them with technical assistance. And one thing that we've heard from Urban's group is just general confusion about, why do I need this booster, this updated booster? Like, what is this, right? I just got the monovalent booster or the old booster. Now you're saying I need something else. So how have you all on the ground, I'm really interested in that perspective of explaining the importance of it, how it's different, why it's still significant now to get it, to stay protected. Like, what are those talking points that you all use?
Hi, I think that's a good point that you bring up. I think the Health Forum operates in a similar capacity. We also have subrecipients that are on the ground. We work with a lot of community health centers. We work with a lot of organizations that do this sort of outreach. And it's hard. I know that when the first booster shot came out, they had a similar problem of, I just got my primary series. Like, why do I need a booster? What is are we expected to continue to get boosters or like an annual vaccine? How do we continue to, how do we make sure that people stay protected? And I know that besides COVID, that's been an issue with like getting the flu vaccine every year. Like it's hard to continue that messaging of like, why should we continue to get vaccinated against flu? And so I don't really have an answer for you. I think that is a struggle that we are hearing a lot. And just echoing what Anthony said at the top of the meeting, I think a lot of our subrecipients, a lot of our community partners are trying to find innovative ways to sneak in that messaging into other events that they do. If they're, having that sort of talk story event, they're talking about community, they're talking about the strength within their community. Sometimes they'll insert a little bit of, this is why our community is so strong, like this is why we have to keep protecting our community, and insert a little bit of that COVID messaging in there. But it's definitely difficult. And I think it's definitely a challenge within different communities as well to try to figure out what's the most innovative way to outreach and reach their communities.
I'm also, thank you for that, Holly. I'm wondering with the flu season, I guess we're in it. I was going to say upon us, but we're in it. What has been the messaging there as well? Like, has there also been kind of that sneaking in? I've also seen that. I think that's pretty common, of using other community events, for instance, especially later in the fall, like Thanksgiving, doing turkey drives and all of that, and then combining it with community health events has been really impactful. Have y'all seen any examples like that as well?
I can speak from experience. This past weekend, I was actually in San Diego, where the Pacific Islander Festival Association hosted their 28th annual Pacific Islander Festival. And this was like the first one in person since COVID, since the pandemic began. And I think a lot of folks were really charged up to attend. And two of our subrecipients had booths or tents set up. So the way it was set up was, obviously you got the classic like food set up. Everyone loves food. So and then the arts and crafts, the different type of NHPI cultural tables, educational booths were also there. And then obviously like their sponsors and everything else. And so in those stations, they had like this COVID passport, so that if you visited 4 of the stands, like you would be entered in a raffle. So like Hawaiian Airlines was a sponsor, so like it was a sponsor to get you and +1 a free trip to Hawaii. But one of the booths was the one of the COVID-19 partners, and so at that table, they would recommend next to the medical tent, like aside from getting first aid from the festival, you could also get your COVID-19 shot and your flu shot. And one of our staff members also happened to get their flu shot there while we were there. So that was a great way to combine like, a family fun, entertainment filled festival with COVID-19 vaccination uptake, as well as flu.
Yeah, I was just going to add that I have seen a lot of this strategy from our partners, like back to school activities, any health fairs or college, back to school, even for college events. So they have tried to incorporate, their planning for COVID and flu vaccine and in conjunction with what's happening in the community. I think, otherwise the numbers would be pretty low turnout if you were just trying to hold an event just for COVID. At this point, people's interest seems rather low.
Yeah, I was going to add that that's a good point that we keep hearing about COVID fatigue. That's been kind of a term that a lot of folks have used. And you're so right that you like put COVID on it, people may not want to engage, especially with being so far into the pandemic. They're like, maybe I am already vaccinated. I'm tired of hearing about it. Or they have their mindset that they don't want to for any number of reasons. And they just don't want to hear about it. So incorporating it into like broader messaging or events that are already happening in your community. You mentioned having food. I mean, that's always a driver, right? Things like that could definitely draw people out and encourage them to engage a little bit more. And then you kind of can slip that into the conversation. Is it Ilona? Did you have anything to share? I want to make sure that you had some space to engage as well, if you had anything to share with the group.
Oh, thank you. Yeah, I'm actually quite new to my position, so I haven't been involved in a lot of outreach yet. I know that my community, sorry, I have some background noise. My community health center has just been doing a lot of tabling and kind of more one-on-one conversations with community members at other community events. I think last month we tabled at a Colorado soccer game, which was very exciting. Kind of just talked to people about the new bivalent vaccines to just try to get people informed about what was going on and the options that they had for getting updated on their boosters.
Thank you so much for sharing. Thank you so much for even coming to this event, being new to your position, and hopefully it's been useful. And I think, Holly, you were coming right off of mute. I may have interrupted you earlier. Did you have anything to add?
Oh, no, it's okay. I was just gonna second, what Samara said about coupling COVID events and outreach with like broader events because of the COVID fatigue. I think we've heard from another one of our subrecipients, community partners, that they have a pretty established health fair that they put on every year that a lot of the community members know about and go to. And so they kind of have segued from just COVID specific events to gearing up for this health event, and they can have a COVID booth there. And so it can kind of be like a one-stop shop for all health related things, and you can get your, updated COVID vaccine, you can get your flu shot as well. So I think we're seeing a little bit more of a switch of not COVID focused activities anymore as a way to continue to be innovative in our messaging. Sorry, I didn't mean to take all the time.
No, this has been a great discussion. And yeah, it'll close automatically for us, but does anybody else have any last thoughts? Anthony, did you have anything? I know you're supposed to be facilitating us. I feel like I kind of took it over. I'm sorry, but just wanted to keep the conversation moving. Did you have anything else to add before we wrap up?
No, I think just to like add in like a little bit of something for resource creation. I think, this is like one of the best ways to have, community driven, community led by allowing them to tell their story. That's how we've been doing some of our resource.
Hello, everyone.
Hello.
Well, welcome to the breakout room. Feel free to turn your cameras on since we're just a small, intimate group. As you met me before, I'm Lance Collar with the National Alliance for Hispanic Health. I'm joined by Jenny Haley, who's with the PAVE program. And we will be talking about the topic of community health workers and how to make best use of community health workers or promotores de salud. Maybe you guys could introduce yourself real quick. I'll pass along to Anne Marie, so you can introduce yourself since I know you.
Hello, everyone. I'm Anne Marie Vasquez. I am the Marketing and Outreach Manager at Borinquen Neighborhood Health Center in East Harlem, New York City.
Great. Audrey? Okay. Are you able to introduce yourself, Audrey? Oh, okay, you're connecting to audio. Okay, we'll come back to you. Sherry Dowdle?
Yes, how you doing? I'm with the
Good.
Centers for Disease Control and work on the social media team.
Oh, okay. All right, great.
Thank you.
All right, so as we talk about these topics, does anybody have any, would anybody like to talk about how to make best use of your community health workers or promotoras, or are interested in that topic? I guess Jenny put the questions that we'll be reviewing in the chat.
So I am really interested. This is Audrey. I'm sorry, I was
Sure,
signed up
sure. Tell us
to
where you're
devices,
from.
so I apologize. This is Audrey Lawrence from the Conference of National Black Churches in Atlanta, Georgia. Actually,
Oh, okay, great.
yeah, about the community health workers. So I'm really interested in that topic because we'll be rolling ours out across the nation. We kind of have 6 satellites or 6 regions, and we'll roll out pods, several pods in those different regions. So hearing about how that works is really of interest to me. The plan is that will be one of the main ways that we make the work sustainable. So it's a way of providing resources to health ministries with those pods being located in churches, but also to the communities themselves.
Yeah, sure. Didn't we speak?
We
a
did,
few weeks ago?
yes.
Yeah, okay.
Yes, we did. Thank you very
All
much for your wisdom that you passed on.
Anne-Marie, are you willing to share a little bit about how you've organized your promotora program?
Sure. I've had them for like a year, right? So basically what I have them go out with the outreach team, because I am the manager for the outreach department here. So they're out in the community at events that are part of our partners, with our partners in the community at our events. We hosted a fair a couple of weeks ago, and I have them out in the fair talking to people, providing them information. I have them in the schools, in the pools. I have them everywhere. They're out there every day, just talking to people, having conversations, giving them information. We do have we're FQHC, and we do have a vaccine site on site. So we definitely connect those that are interested in getting the vaccine with our site. So yeah, I have them everywhere. Definitely working with our outreach department. I even have them in here inside the FQSC whenever it's cold or it's ugly weather. They're inside, and we have 4 floors. They're in every waiting area in each floor, just giving information, talking to people about the vaccines. So that's how I've been working with the promotores. And we also have a medical van that we have out in the community. We go to businesses, organizations. We have a lot of NYCHA developments around here. So they're definitely out in the NYCHA developments, working with tenant associations, and I have them everywhere. So I've tried everything.
That's the New York City Housing Authority?
Yes, New City Housing, correct.
Okay.
So there's been a lot of talk about this being, and we have found it to be true as well, this being very much the individual conversations at this point, because the masses have kind of come forward, but it's the individual conversations. Are you finding that those conversations with the navigators are what's key to making this happen at this point?
That question to me, or?
It is.
Oh,
as
okay.
you're having the conversations with individuals, is that
at this point, yeah, at this point, definitely, it's definitely, how should I put this? The numbers have come down in terms of, people getting vaccinated and stuff like that here in the city. But definitely the conversations are what's getting people out here to get their vaccinations. When we ask those that come in, how did you find out about it? Well, I spoke to someone, or I saw a flyer. Somebody was putting up a flyer and I spoke to them about it. So yeah, definitely those one-on-ones are very important. At the time, when our first year with you guys, at that time, there were surveys that had to be completed. And that definitely helped out a lot with the conversations, just that one-on-one, filling out those surveys. Now we don't have to, so it's a little different, but yeah, those one-on-ones definitely worked.
Those surveys were for a previous grant.
Yes,
that was funded through HRSA. Yeah.
Right. We had to do the survey, so that definitely helped a lot.
Yeah, those surveys had questions about kind of assessing people's reason for hesitation if they had been hesitant in the past to
Right.
kind of learn about what their motives were and what motivated them to get vaccinated that day. So that was a requirement of the grant that we had. So we had to do that data collection.
I hope I answered your question.
Absolutely. Yes, yes.
So there's some other questions we could talk about, basically talking about how we can increase flu and COVID uptake or what we're doing to increase the bivalent booster. Does anybody have any thoughts about those questions? Or if there's other burning questions you have about your grants that you want to discuss in this smaller group.
So I think as it relates to the booster, it seems to me the conversation around vaccines in general, for many of the communities that we serve, are going to have to be it's going to have to be a normal kind of conversation. So not something, oh, and it's a, yes, let me plan that sort of scenario. So just moving it from an event-driven focus to a common conversation focus, just the same way we take our kids to get their vaccinations prior to school, or as we'd have the conversation about whether or not we would take our kids to get their vaccinations prior to school. Because I know many of my son's parents, or the parents of many of my son's friends, really started having conversations around whether or not they would do the vaccines. And so those conversations, those kinds of conversations became much more commonplace. And I think making them much more commonplace is really what we're going to have to do. So it doesn't feel like it's something different or something out of the ordinary, et cetera, et cetera. So I do think somehow we're going to have to normalize the conversations.
Okay. And that's kind of what our community health workers are doing as well, by having conversations with people in their communities. They're kind of normalizing it. Do you have any other thoughts, Anne-Marie, about your strategies?
Yeah, can I just say something? Yeah, now before in the past, it was us giving out information. Now we have people asking us questions, where before people weren't asking. They didn't want to know about it. They were upset when it was a mandate, number one. And yeah, so we find ourselves now at the opposite. Instead of giving out information, people are asking us questions, you know. So especially with the whole, and I'm glad we had that training yesterday, because there's the main question here is, so if I got COVID, when can I get the booster? I think that was one of the questions yesterday in the training. That's a big one here in New York City, because a lot of people are getting infected with the what is it? The recent one, the
Omicron?
Yeah, that one. Sorry.
BA5 is the current
yeah, that one.
variant.
So
yeah.
a lot of people are asking the question, when can I get the booster? When can I get the booster if I already got COVID? Or, you know, it's been a couple of weeks that I just, you know, had COVID. So that's the main one here. But I think, yeah, definitely it's now the opposite. People asking, or even now with the 6-month-old, questions about, can they mix and match? They're emailing us. Can we mix and match with the flu? Can they take the flu? Can they take the COVID at the same time? Can we mix and match? It's like now people are asking more questions now. I feel, especially with the kids, with the 6-month vaccine. That's what I feel like. It's more now, instead of us giving out all this information, now they're like, okay, I don't, you know, they have all these questions down. It's like the opposite. That's what I have.
Cherie, did you have any thoughts about messaging, since you work with social media?
What was the question?
Do you have any thoughts about messaging around increasing flu and COVID vaccine uptake?
Well, I guess that it has to be correct and targeted to the right people. Like we were talking about the phrase Latinx to different communities, and people were insulted and didn't want you to use it. So, and that was a big one for this week. So,
oh, is that something that happened this week?
Well, yeah, because, you know, we were talking about it on social media, and that one just kept popping up and popping up. And so we were trying to figure out what to do. And people were saying that, you know, before you speak to your people, ask them, what do they prefer? Don't just go in there and just start using that phrase.
Yeah.
So that was a big deal this week. So
yeah, we got some feedback from our partner in El Paso, Texas. When they saw the CDC sent out some information and used the term Latinx, and they were like very adamant, no, use Hispanic or Latino, don't use Latinx, because it's not a term you use in Spanish that typically. You know, it's hard to pronounce that in Spanish. That's not a term that really. I mean, I think Pew has found very few Hispanics actually apply the term Latinx to themselves.
Mhm.
So that's interesting that you found that out.
Okay, thank you.
All right, I guess we have about another minute or so. Any other comments, concerns, or if not, we can just, I guess, head out of the room. All right, I'm gonna go ahead and close out. Thanks everyone for chatting.
Thank you.
And I can also chat questions for us if that's helpful, Chinny, as you're going
Yes,
through
it
them.
is. Thank you.
And jot some notes too for our report back. So I'm Bridget Courteau, as you all know, I'm the director of group learning. And so I do a whole lot of things for PAVE and with events and all the different components of the learning community. And I'm trained in public health. And my areas of expertise prior to really being involved in this big program have really been more kind of insurance focused and women's health and maternal and child health. So
Nice. Thank you, Bridget. And my name is Chinny Okechukwu. I just shared, I am the quality improvement. I don't know if I said that. I'm the quality improvement and equity project manager at NMQF's SHC. And being a year today, actually, today is my first year anniversary at NMQF. I'm excited at the opportunity to be working with NMQF, this opportunity to make an impact in different communities, especially communities of color. And excited to be here today. Thank you. Lionel, can we hear from you? Or Morgan, if you're ready?
Hi, I'm Morgan. I'm the reporting lead for the PAVE grant for the Urban League of Greater Oklahoma City. I've been doing it for about 6 months, and I'm just here to learn from you guys and see if I can, bring anything back to the Urban League about how we are surveying vaccines and getting them out there to people.
Sounds good. Thank you, Morgan. How about Lionel? Maybe he's not there. Or she's not there.
we're having trouble getting off of mute. Let's move on though. We'll see if we can get if Lionel there we go.
Can you hear me now?
Yes, we can.
Yes, we can.
Hi, I'm Lionel Conley. I'm with the Conference of National Black Churches, and I am based in Indianapolis, Indiana, and I work with all of the faith-based groups here out of Indianapolis and spreading the word how we can better protect ourselves on weekly and monthly meetings in different locales about the vaccine.
All right. Thank you, sir. I believe I've heard you share before at one of these meetings, and you guys do great work. Thank you. So, question for you all. What are you thinking? We're going into the fall, flu season is coming up, and yes, folks are tired of hearing about the vaccines. And we understand, so we've been talking about this almost going on 3 years at this point. What creative ways, we know these conversations are important. What creative ways can we continue to have these conversations? And it's not just about folks being tired, it's also about the fact that, clinics, there's staff burnout for clinics. Clinic staff sizes are shrinking. How do we keep people focused on doing what they need to do, what we know they need to do, and just continuing the conversations?
I think that is the most important part, is continuing the conversation with your focus groups and to let them know that the seriousness of the vaccine and other, ailments are upon us, and to notify them as much as possible that we can continue these conversations about how serious it is to be vaccinated and to do all of the necessities of trying to fight against these diseases.
Sure, that's very true, sir. I agree with you. But how about, we need clinicians, right? In this, not just, so like I said, it's not just the conversations, we need clinicians. I'm hearing more and more staff sizes shrinking. People are burnt out. What do you think we can do even for clinicians to keep them just staying where they need to be, doing this work that they need to do? Any thoughts?
I think incentives are a good idea, not necessarily like money incentives, but maybe just like group activity incentives, maybe not like career advancement, but maybe just little perks that they can get if they continue to help out and do what they need to do. Burnout is a real issue, and
Yes.
yeah, and I don't know, other than the perks, if there's anything we can really do, just because COVID is so draining.
Yeah, I agree with you, Morgan. And the reason I'm asking this is because we've tried a couple of things, and that's why we're reaching out at this point. We've done friendly staff competitions at our clinics and some of our facilities. We've done kudos cards. We've done Starbucks coffee, just to say thank you. We've done thank you notes, handwritten and emailed, and so we're just like at this point really fishing for ideas, because we want to just keep making them feel as important as they are, and keeping them encouraged to keep doing the work.
I would think maybe like small award ceremonies, like just acknowledging the fact that they have worked hard. Maybe like you could do like awards for like the longest serving clinician for this COVID outbreak. That's really all I can think of. Like I said, it's just really hard.
Yeah, but that's a great idea. Thank you.
So can I ask a quick sort of this clarifying question, just as a fly on the wall? So these are kind of incentives for the volunteers that are staffing vaccine clinics. Are there other clinicians that you're thinking of, Chinny? Just trying to put some kind of
so it's both, actually. Yeah.
Okay.
It's both. So it's both volunteers and as well as clinicians
and the staff, like the
and their
permanent
staff. Yes.
Yep. That are the vaccinators. Yeah, because we've been hearing a little bit about the vaccinator from the stuff that boils up to us. It takes a while to kind of get to us, and it may be a lot of people experiencing the issue, or it may just be a small number. So, but I've been seeing more and more over the last maybe 2 months, kind of concerns about this like vaccine, that there aren't enough vaccinators basically, and that's kind of an issue that wasn't so much the case at the beginning of the pandemic, right?
Yes, very true. And just to buttress your point, one of our program, the Hair Wellness Warriors. So part of what they do is get vaccinators to their spaces, right? And they try to get some. So about 2 of them actually came back to the group and reported that the providers they've been working with didn't want to do it anymore because they felt like people didn't want to get vaccinated, and it's harder in some places, especially where the mandate is very liberal. It's harder to get people to engage as much as where it's still required. And so their providers weren't willing to come out. And so we had to find alternative. We had to put our thinking caps on and try to find alternative ways to vaccinate those who were ready to be vaccinated. So we're doing things like sending out pharmacists instead, PAs instead, Yeah, so it's just trying to work around those kind of barriers.
Well, I think one of the most important parts is to constantly remind them how serious it is, because, one thing you must always do is try to help yourself and look out for yourself. It's like the situation with the hurricane in Florida. They give you the fair warning that it's coming and tell you to evacuate. But if you don't take heed to it, then whatever happens to you, and I look at it the same way personally with this virus. I mean, that we've gone through a period of how serious it was, and we saw how people were not prepared and the effect that it had on them. So I think we constantly have to let them know the seriousness of this, and you must help yourself and do whatever you can. And I know people say, well, I'm burned out. Well, you know, if you're burned out, you don't want to get burned up. So we have to look at it along that line and not to be comical about it. I'm just serious. These are the personal things that I never took it lightly, that I must do something to help myself. And if a vaccination would do that, you know, there were people who didn't even want to be vaccinated during the heavy load of this virus. But I think we have to constantly deal with that. And mine is a little bit more unique because of all the ministers that I work with, to get them to remind their congregations the seriousness of it.
I hear you, sir. I hear you. And we're just hearing you, something that comes to mind is maybe using personal stories, you know, of how seriously people were affected, and you keeping those at the forefront, you know, to continue to send out this messaging of how that it's serious, and it still is, right?
Yes.
Yeah. Thank you so much.
Very serious.
Can I ask a follow-up question, Lionel, for that, or for others too, who have been who have used maybe this kind of messaging tactic to talk about the serious side effects? And I think it is, you know, because there are now a lot of people who've had COVID when it hasn't been serious. So you are kind of battling against that, right? And so it's kind of telling both sides of the story. Have you focused on long COVID? And I'm asking this because it has come up on the group learning team. You know, we try to think far ahead to what kind of events we might, or topics we might focus on. In long COVID, sort of a more science behind it, what it is, that sort of thing has been raised as a potential kind of group learning topic, something we could do an event, a webinar session on. So I'm wondering how much you focused on like long COVID specifically. Oh, we only have a minute left.
Ooh. I don't know if you're going to say something, Lionel. Yes, so we have incident. It's funny that you say that, because we have been doing that. It was part of our strategy in the summer, and it's going to be part of our strategy. As a matter of fact, we have an upcoming webinar with 2 pharmacists, one who was heavily involved with our churches in the summer, and the other from Nova Script Central. And one of the focus of that webinar is actually long COVID, using the stories of long COVID, the effects of long COVID, to continue to message the importance of getting vaccinated.
Yep. That's great. And if you don't know that you can also promote those events through us, you should do that. We have it, put them on our event calendar as their, because like we don't want to reinvent the wheel if our partner's already doing something that we can advertise.
So I'm going to message you privately, because one of my notes from today is that I'm not a part of that listserv.
Oh, okay. So we'll make sure that you are, because that sounds like an awesome event that others might be interested in.
Okay, I think we're all back. We're coming back still. Thanks so much, everyone, for the rich discussion in the breakout rooms. I'm going to ask the facilitators if they can quickly summarize some of the discussions that they heard in each of the breakout rooms. So I'll start with Lance.
Sure, yeah. In our breakout room, we talked a little bit about the question about community health workers. We had someone who works with the National Association of Black Churches talking about their desire to set up a community health worker program using pods in their churches. We also had someone from our program, from the National Alliance, talking about their existing community health worker program that goes out into the community and talks to everyone. And one of the praises that Audrey mentioned was about normalizing conversations and making these type of conversations commonplace, so that people are expecting that this is a conversation you have about vaccines. And something that was mentioned by our partner in Harlem was about that they're not having to go out and talk to people as much, but now that things are changing, and like the new booster, bivalent booster has come out, people are actually coming in to ask questions rather than them going out and trying to look for people. They're having a lot of people coming and ask questions about these new things. And finally, we had someone from the CDC social media team talk about the term Latinx, and how that this past week they had an issue with using that term, and there was some pushback from the Hispanic Latino community not embracing that term. And so it's all a process of learning and asking communities how they would like to be addressed.
Perfect. Thank you so much, Lance. How about we go to Anthony?
Yeah, so in our group, we tackled several things. One of them being the challenges and strategies that we're hearing on the ground to combat COVID fatigue. We've all been hearing that COVID fatigue has been coming from our communities and addressing some of those challenges. And so in addressing some of those challenges, some of the things that we've seen are kind of combining that COVID-19 flu messaging alongside other events. Recently, I talked about my experiences with our Pacific Islander communities where they hosted their Pacific Islander Festival. So, you know, combining community, family, food, fun, and entertainment, while also allowing the community members access to get their flu shots as well as their COVID-19 boosters at these events. And so in terms of these strategies, it's more so combining the messaging with our events.
Okay, perfect. Thank you so much, Anthony. And last, Ginny, if you can quickly summarize what the discussion centered around in your chat room.
Interestingly, thank you, Samara. Interestingly, we too talked about combating fatigue, but we were more so talking about how to not just continue to have the conversations, but also continue to motivate and encourage healthcare providers and vaccinators to continue to do the good work that they do. And one of the suggestions we got from Morgan was having small award ceremonies, probably one for the longest serving provider or clinician throughout the pandemic. I believe that was, I don't see him here now, the gentleman I believe from the churches, Lionel, thank you. So Lionel gave a great suggestion about making sure that we continue to message and continue to emphasize on how important the seriousness of COVID is, and using that to reinforce that even though people are burnt out, people may be burnt out, but they don't want to, they still don't want to get sick, right? So continue to emphasize that. And just to piggyback on that conversation, Bridget had talked about using long COVID as a message, as a form of messaging to make sure that we continue to emphasize the seriousness of COVID. And I shared with our group that one of the things we're doing, which is, so we have been doing this, but one of the things we're doing going into the fall is we're having a webinar on the 28th of October, where one of the strategies is to use long COVID as a strategy tool to continue to emphasize the importance of getting vaccinated and the importance of COVID being still being serious.
Okay, thank you. Perfect. Thanks everyone again for your time. I'm sorry. So I don't know if you have any additional questions. Do we have time for a Q&A?
Yeah, we do.
Okay.
we
have a couple
definitely have
minutes.
a few more minutes, and I just wanted to add to what Chinny was saying. So we are thinking about, I mean, we're constantly trying to get information whenever we have a chance from learning community members. What kinds of things might we focus on in the coming months? So long COVID has come up. So I was asking the group, in my breakout, and was thrilled to hear Chinny's group has something planned, and encouraged her to share it with us so we can share it with everyone else if it's open to other members, but also maybe it's something we might consider in the next few months for the broader learning community too, doing something on long COVID. So yes, if you have any questions, you come off mute and speak them now or put them in chat. And while we pause for a second for that, I will also just share a couple upcoming learning events, which is that we have we have two things happening next week, right at the beginning of the week, a member orientation. It's like a 30-minute presentation and time for Q&A, and we'll share some materials that are meant to help with onboarding learning community members. It's not just for new members, though there are some of those. It's for anyone who wants to just refamiliarize themselves with the learning community or hasn't been very involved and wants to learn more about what we offer and how to get involved. And so I will chat the registration links too, because you can't get to them from here. And then also on the 4th, we have a few slots still open for our co-working session. This is a 2-hour work block to work on your performance measurement reports that are due in October. So if you want to sign up for this, come with work to do. A lot of the time it's these work sprints where there's music playing in the background, but you work independently, but side by side. So time to get some work done on your reports if you're interested in that. I don't see any questions coming through in chat. Does anyone want to speak a question? Don't see anything or any hands raised. So Zara, why don't you launch our satisfaction poll? And while you do that, I will quickly pull up my my chat or my links so that I can send those out through chat as well for these two events that I just mentioned. So here's one for October 3rd. And here is the second for October 4th. Okay. Well, thanks all for doing the poll. And I don't see questions coming in, and I think we're right close to the hour anyway. So I think we can just end. I will start with thanks and just say thanks, Samra, for the good idea that came out of 2106 and for raising it to our attention so that we could do these quick talks. And thank you certainly to Lance, to Chinny, and to Anthony for your great talks. And we will make sure to get these materials out to the rest of your 2106 funding stream and others in the learning community. And there's always a large group that kind of gets these on demand as well. So, so we'll do that as soon as we can. So thanks all. Samra, I don't know if you have anything to add before we close.
Just want to say thank you, Bridget, and to you and to your team for organizing this. And thank you to the speakers again and for the participants. Have a great day.
Thanks all.
Thank you.